Hi, my name is Kaniz. I'm a mom influencer and the job comes with lot of hectic routine and a lifestyle that is difficult to maintain. So yes, one flip side was that I was facing a lot of hair issues. So I've come here to recon to Dr. Pragati and she has suggested me PRP for my hair loss and to improve the texture of my hair. So I'm going to ask her what exactly PRP is and how is it going to benefit me. Let's hear from her. Hi Dr. Pragati.
Hi Kaniz.
So tell us what PRP is. It's such a big word. Please simplify and let us know what exactly it is.
Sure. So PRP basically stands for platelet-rich plasma. Now PRP therapy has been around for ages. It's been around for decades. It's very recently that we've started using PRP in aesthetics. The most common use, of course, being for hair loss, but then we also use it for wound healing and facial rejuvenation in general.
Oh, that's nice. So doc, why platelets and how does it works in PRP?
So platelets are a specialized type of blood cell. Our blood is basically made up of three cells: the red blood cells, the white blood cells and platelets. And all these cells float around in a liquid called plasma. Now platelets in particular are very rich in growth factors and in bioactive molecules. So when the concentrated platelets are injected into the scalp, what it does is that the growth factors and bioactive molecules present in the platelets, they promote hair growth. So overall PRP, of course, it prevents hair loss. It also promotes new hair growth and increases the thickness and strength of your hair.
Who is an ideal candidate for PRP?
So PRP can be done by both men and women who are suffering from progressive hair loss. It is also sometimes given as an additional stimulant therapy to people who are undergoing hair transplant.
So doc, how is PRP done? Explain us the process in a little brief.
Sure. So the patient's blood is drawn just like getting a blood test, and then it is placed in a special centrifuge machine. The centrifuge separates the RBCs and the platelets and the plasma. We discard the red blood cells and the remaining platelet concentrate is used for treatment. It is this platelet concentrate that is directly injected into the scalp.
Doc, is the PRP therapy painful?
So Kaniz, if injections are used to deliver PRP, moderate discomfort and pain is expected during these injections. We noticed in our practice that sometimes this leads to non-compliance amongst our patients. This led us to introduce a revolutionary technology for PRP treatments at Recon, which is totally painless. That is the microchip transdermal and electroporation technology, which we use for all our PRP therapies. With the help of this technology, we can penetrate the protective barrier of the scalp to establish microchannels. Through these channels, PRP can be introduced into the deeper layers where the hair follicles lie. So Kaniz, what we've noticed is that now our patients are happier, they don't complain of pain and are more compliant to their therapy.
That's amazing. So doc, how much time does the PRP procedure takes?
So the process from collecting the blood to centrifuging it and then actually delivering the PRP to the scalp, it takes around 45 minutes.
So doc, how long does it take for the results to show up, and once you have seen, how long does it last for?
So since Kaniz, this is a biological process that the PRP is mimicking, the results are not immediate. You will have to wait 3 to 4 weeks for the results to start showing. And once they appear, they last from up to 6 to 12 months. Now, of course, the results do vary from person to person, and also how long the results will last, that also varies from person to person. Again, depending on factors like the cause of your hair loss, the duration of your hair loss, age, medication, etc. So initially we recommend around 5 sessions, 1 month apart, and then we tell you to take a maintenance therapy, say once or twice in a year.
So doc, are there any patients who don't respond to PRP injections?
Yes, Kaniz. Unfortunately, there are some people who will not respond to PRP therapy for hair loss. Like people who may have had a trauma or a chemical injury on their scalp. Also, PRP does not have any role in baldness, where the hair follicle is dead or absent. How I explain this to patients is to think of the hair follicle like the root of a plant and the PRP as a fertilizer. Now the fertilizer will only act if the plant root is present, even if it's in a weak or a feeble state. Similarly, PRP will also only act if the hair follicle is present, even if it is in a dormant state. So PRP has no role to play in baldness where the hair follicles are dead and absent. In such cases, a hair transplant is recommended.
So doc, one of the very important questions, are there any side effects of PRP?
So Kaniz, PRP is quite safe because it's your own blood that we are injecting into your scalp. But after PRP injections, some patients do complain of pain, bruising or swelling, maybe some amount of redness also. However, in Recon, since we've started using the electroporation technology, we've had no such cases present to us.
Oh, that sounds interesting.
Yes.
So before doing the PRP, do I need a consultation with the doctor?
Yes, it's very important that you consult a doctor. It's not a treatment that you can just, go into a clinic and order, because we recommend PRP therapy only after taking a detailed history, trying to find out what the cause of your hair loss is and whether or not PRP is appropriate for you. Sometimes we may have to order certain blood tests to rule out any autoimmune or hormonal disorder which has been causing the hair loss. And also it's very important that the doctor checks your hair and your scalp so that they can better recommend other supplementary treatments for hair loss.
Thank you, Dr. Pragati. That was quite insightful.
My pleasure, Kaniz.
So guys, hope all your queries regarding PRP has been answered, and if you would like to book your pain-free PRP session with Recon, all the details are given below. Do contact and book your services now.
Dear customers, thanks for accepting the invitation and attending this meeting on time. This is Cornelius. I am the business manager of Wyndham. We are the manufacturer of Mesoskin. And today, we are happy to invite Dr. Pragati, a very famous surgeon from Recon Clinic, to give us a presentation about the application of Mesoskin in the scalp PRP therapy. So we hope that through this meeting, you will have a deeper understanding of EPM technology and the clinical presentation application of Mesoskin. And firstly, I will introduce today's main speaker, Dr. Pragati. Sorry, Dr. Pragati, we should unmute you.
Yes. Hello, everyone. Yes.
Yeah. So Dr. Pragati is a very famous facial plastic and reconstructive surgeon. She is also quite professional at non-surgical procedures in aesthetics field. And she has a very good reputation in many places like Italy, Austria, Germany, Taiwan, Hong Kong, and so on. So that's quite an achievement, right? So now I will briefly introduce today's agenda. The first part is Dr. Pragati will introduce what PRP is and the principle of our device Mesoskin, and how Mesoskin combines with PRP therapy for hair loss treatment, and our Q&A section. So in order to ensure a high quality meeting, we will temporarily mute all participants during the presentation. So if you have any questions, please leave a comment in the comment column or ask them in the Q&A section. Thanks for your understanding and support. Now let's welcome Dr. Pragati to start the presentation.
Thank you so much, Cornelius. Hello, everyone. I am very happy to be here today on behalf of Wyndham and Mesoskin. And I will be talking to you all about scalp PRP therapy using their device. So today I will be talking about scalp therapy with PRP using Mesoskin. I'm Dr. Pragati Shubha, as Cornelius has very graciously introduced me. I'm a facial plastic surgeon and I practice in India. In India, I practice in Gurgaon, which is supposed to be the most cosmopolitan city in India and very, very famous for aesthetics as well. This is a quick tour of the center where I'm the director as well as facial plastic surgeon. We have a beautiful blend of a surgical aesthetic practice, as well as, of course, we are practicing and consulting a lot of patients for non-surgical aesthetic procedures like lasers, Botox fillers, and of course, PRP therapy. And this is where most of our surgery and procedures happen. Along with the clinic that I run, I also am a trainer for aesthetics for doctors. So in association with the Canadian Board of Aesthetic Medicine in India, we are their designated center, and we run a lot of courses for doctors, because I think there's such a huge demand for non-surgical aesthetic procedures, not only in the world, but in India. Like in a developing country like India, people are more aware, and there's a very great awareness regarding these procedures amongst the general public, and hence, of course, a greater demand for training for these procedures. So we are, of course, training for Botox, fillers, lasers, PRP, and aesthetic assessment in general. Now, I think we'll start with the presentation. Before I talk about PRP, it's important to briefly tell you about the hair anatomy and why are we using Mesoskin or any kind of mesotherapy, or why are we using PRP. So the hair anatomy is primarily divided into two. There's a hair shaft, which is the non-living part of the hair, which lies above the skin surface. And then, of course, you have the hair follicle, which is the living part of the hair, which is lying beneath the skin. Now, it's the hair follicle that we are more interested in when we're talking about hair growth treatments. When we're talking about the hair follicle, it not only has a hair bulb, which we call as the hair root, but it also has an outer and an inner sheath. Why they're important, without really boring you with the anatomy, is if you look right at the bottom of the hair bulb, this is where your mesenchymal derived dermal papilla are lying, the blood supply, the nerve fibers are lying, and this is actually the point of regeneration of hair, where the new hair starts to form, along with the stem cells which are located in your inner sheath. So this is the area that we're also trying to focus on for any kind of treatments that we are doing for hair loss today. This is the hair cycle. Most of us have seen what a hair cycle is. It goes through the active phase, which is referred to as the anagen phase. Then, of course, it goes through the catagen phase, and then into the telogen phase. Anagen phase, of course, being the growth. Just a second. Yes. So anagen phase is your active growth phase, which lasts for 2 to 6 years. That is when the scalp hair is visible. That is your anagen phase. Gradually, the hair starts to miniaturize and goes into the catagen phase, which is your transition phase. And then, of course, it totally dissociates from its blood supply, its nutrition, and enters the telogen phase, where the hair is lost. From the telogen, again, it re-enters into the anagen phase. And again, any treatment that we're trying to do for hair loss, we are trying to enhance conversion from the telogen to the anagen phase, trying to fasten it, because in hair loss, anagen to telogen phase has been ramped up. So it's the same thing. The things that happen with hair loss, we're trying to correct with hair loss therapy. Right. So the main factors which are responsible for hair loss, of course, there can be a failure in the production of the normal hair follicle. There can be an abnormality in the hair cycle that we just discussed, or there could be a destruction due to injury or trauma to the hair follicle. Just a second, my screen is acting up. Okay. Now, what are the various types of hair loss that we see? Of course, there's localized, and then there is diffuse hair loss. It's the diffuse hair loss which is more common, and amongst it, this non-scarring kind of hair loss that we see, which is happening in your telogen effluvium, stress-induced or androgenic alopecia. This is the area of hair loss where PRP really or truly works. So hair loss, non-scarring, diffuse is where we are using PRP in our practice. This is what I was talking about. The right side of the slide, of course, where the anagen to the telogen phase is fastened or ramped up in hair loss diseases, factors which influence it being hormone disorders, could be genetics, of course, increased stress nowadays, nutritional deficiencies of some kind, medications, inflammation, and infection. And then we try to reverse it with therapies which are aimed at increasing or maybe speeding up the conversion of the hair from the telogen to the anagen phase. This could be done by increasing the blood flow right at the bottom of the hair follicle, which is the hair bulb. It could be, again, due to increased growth factors, again, targeting the hair bulb, or it could be due to direct stimulation of hair growth. So what are the hair loss treatments that we're looking at nowadays? These are time-tested treatments which have been here for decades and still hold true. PRP, of course, is relatively new, but hair loss treatment more or less remains the same. And the most important amongst them is treating the underlying cause. So it's very important to first and foremost diagnose the cause of hair loss. If it's hypothyroidism, if it's a nutritional deficiency, if it's a fungal disorder, you need to treat the underlying cause before you go and prescribe a PRP therapy or an oral medication to anyone. The second, of course, are your oral and topical medications like minoxidil, finasteride, spironolactone. And then we come to non-surgical procedures, which include PRP therapy, mesotherapy, microneedling, and LED lights. And last are your hair transplant surgeries. This is, of course, meant for people who've permanently lost their hair, and none of the above are working for them. Now, why are we using PRP? I mean, the blood, as we know, is composed of plasma, and we have cells like RBCs and WBCs and platelets. But when we talk about PRP, it, of course, stands for platelet-rich plasma therapy. This is a non-surgical regenerative medical treatment. And here, the patient's own blood plasma is concentrated and then injected into the scalp to promote hair growth. Well, platelets are used because of the abundance of growth factors and cytokines that are present in them that stimulate wound healing of all kinds, irrespective, not only in the scalp, but platelets promote wound healing in the entire body. It also promotes cell growth, angiogenesis, new vascular formation, and tissue repair. This slide is just to show you the number of growth factors that are present in the platelets, from your keratinocyte to your platelet-derived growth factors, to your vascular endothelial growth factors, to your epidermal growth factors. And all these growth factors are also present and required by the hair bulb for hair growth or hair production. So again, platelets being injected or being delivered rather to that particular point in your hair, of course, promotes hair growth. Again, just a slide to show you, as in when we inject the platelets into the hair follicle, you can see the growth factors which are released, delivered to that site, and then, of course, they promote hair growth. This is a very simple video. I actually use it in my clinic to explain to my patients how PRP works in any form of hair loss. I equate a hair follicle to the roots of a plant and PRP to a fertilizer. Just like a fertilizer promotes growth of a plant, PRP promotes growth of a hair. However, it's important that a hair follicle is present for the PRP to act. If there's a dead hair follicle or if no follicle is present, no amount of PRP mesotherapy is going to cause any kind of benefit in that case. So I'm now going to share my experience about the Mesoskin that I use. Before my experience, I'd like to tell you a little about their electroporation therapy. Wingdown has come up with something very amazing. They've actually combined two therapies. One is, of course, their microneedle array, and then there's the electroporation therapy. Combining the microneedling as well as the electroporation, they've allowed PRP therapies to, first of all, become non-invasive, because you must understand the conventional way of injecting PRP into the scalp is quite painful. Even the best of patients really struggle with compliance when it comes to injection of PRP therapy after numbing creams using a mesogun. It's still painful. The second, it does not compromise on the quality of deliverance. So if we are talking about a new therapy which has come along, it is as useful or as effective as the injection. So there is deep penetration of any active ingredient that you're trying to deliver to the skin or to the scalp. This is a video to show. They have an easy handheld device where a blade is put at the front of it. The microneedles in that blade, they help decrease the resistance of the epidermis and create electroporation channels through it using very, very small voltages of electricity. And then the PRP or any active substance is delivered to the epidermis and deeper dermis. So, and the best part about electroporation is that the energy or the DC voltage that they are using is very less. So it does not cause any form of cell death, necrosis, or apoptosis, or any damage to the surrounding tissue. It's delivering where it's supposed to deliver. So it's very specific for that. This is a video of how we are doing PRP at our center. Of course, the therapy starts by taking out a blood sample. We take out around 20 ml of blood from a patient and we centrifuge it. We are using pre-prepared PRP tubes, therefore not the whole cycle of a soft cycle and a hard cycle. And then we load it onto the Mesoskin device. The Mesoskin device comes with an easy handheld. The handle is very easy to use. And as you can see, we've applied no numbing cream. We've just prepared the PRP and we've started the application. The patient is not in pain. She's extremely comfortable and the treatment is extremely fast. Even if you look closely, there's no prick, no bleeding, no swelling. And the entire process for the patient as well as the doctor is extremely comforting. I will just share a few of the patients that we've treated using PRP and the Mesoskin. This patient is suffering from female pattern hair loss. Apart from minoxidil and oral biotin, of course, we've given her 6 sessions of Mesoskin PRP therapy, 3 to 4 weeks apart. And that's the average gap that we do keep between 2 sessions. A gentleman suffering from androgenic alopecia, again, someone where we've used Mesoskin. A patient who had extreme hair thinning after COVID and was also starting to show very sparse hair, a lot of miniaturized hair, and PRP worked wonderfully. In fact, we just did 4 sessions for her and she gained really good results. Another patient with androgenic alopecia. This is an interesting case and I put this slide for a reason. This gentleman is actually a patient of scarring alopecia. He has a history of chemical burns in childhood, and we wanted to actually prepare him for biofiber hair transplant. However, his financial condition did not allow him to go for surgery. And somehow on the internet, he had searched for PRP and said that, no, ma'am, I want to go in for PRP. I can't afford surgery. We did counsel him that PRP may not work on your scalp because of the amount of scarring that's there. But he anyways went ahead with it. And we ourselves were surprised to see the results. Places where the hair follicles were absent were totally dead. You can see the hair has not grown there. But any form of villous hair, miniaturized hair, it showed beautiful results. You can see the amount of density he has of his hair post-treatment. So again, wonderful results in this patient after PRP therapy. This is the back of his head. And again, you can see very beautiful results. So what really has been the benefit or advantage of using the Mesoskin Wingdom's device? When they invited me for this talk, there are no financials involved, I'd like to say, but I was more than happy to do it for Wingdom because this is one of my assets in my clinic. Only because I was using conventional injections for PRP. And we were seeing an extreme lack of compliance amongst our patients, or we had to really go through the process of counseling them too much that it's good for you. And it was a hassle. When I introduced this machine to my clinic, now my referrals for this procedure has also increased because friends are referring friends, families referring family from clinics where they were not having this procedure and they were still going through the needle conventional method of PRP. So increased efficacy, increased or comparable efficacy, because now we use Mesoderm for all our Wingderm for all our patients, and we are seeing very good results. That's why they keep coming back to us. And the biggest and the largest benefit so far, of course, has to be its non-invasiveness and painlessness. I think this has really been a godsend for us because this has really picked up amongst our patients, and they are very, very compliant. And definitely it's a faster treatment. We save time of applying a numbing cream. We save time where patients are not stopping us in the middle of the treatment and telling us, okay, it's paining, wait for a minute, then we'll start again. Maybe 10 minutes is the maximum we do a treatment in. So of course, faster, improving our clinic's efficiency. So these were my views and my experiences with PRP scalp, as well as with using Wingderm's Mesoskin. These are my contact details. If anyone wants to get in touch with me for any other questions that they may have, or if anyone's visiting India, I would welcome anyone who is here. All right. Thank you, Cornelius. That's it from my side.
Thank you, Dr. Pragati. That's a wonderful presentation. And right now is our Q&A section. So if you have any questions, you can let me know. I will unmute you for the questions. But right now, we already see some questions in the comment column. So Dr. Pragati, can you see the questions in the chat box? I think we can give some answers to the customers.
Yes, so I think I have Sylvia, where she's asking, should local anesthetic be used? Will there be pain during the treatment? No, we don't use any local anesthesia before this treatment. And it is painless, but of course, there's a feeling of a pressure stamp from the blade. That's about it, but it's not painful. There's no pricking sensation. The patients do report the feeling of a pressure stamp, of course, which is due to the blade. And can Mesoskin be used to induce? Okay, can Mesoskin be used to induce other medicine or cosmetics to achieve the same hair growth effect? Of course, we are using a lot of meso solutions also, which we try to combine with PRP for the hair. Because we are doing a lot of hair transplants, Mesoskin in our practice is primarily used for the hair treatments, but we're using the pre-prepared commercial meso solutions that are available in the market for this as well. The question is, it's needle-free therapy? Yes, it's a needle-free therapy, totally needle-free. I get the same treatment done. My husband gets it because he's afraid of needles. So I was finally able to convince him for this treatment. What settings do you use for the treatment? I think if you have the machine, probably Cornelius will share that technical detail with you. It comes with a LED screen where you can set the frequency, the amount of product you want delivered, also the kind of voltage that you want. We use it at their maximum setting. All the frequencies maximum. I think it's 5 millivolts, Cornelius, if I'm not wrong. The maximum that it goes.
Yes, 5.
Yes. All right. I think I can't see any other questions.
Okay, yes. Okay, so customers, do you have any other questions for Dr. Pragati to clarify for you? If you have any questions, please let me know too. Okay, Dr. Pragati, can you see the questions from Emily?
Yes, now I can. Yes. So what are the side effects of PRP therapy? There are no side effects of PRP therapy. It could only be that the results vary in individuals. Also, if you've not chosen the right patient, there will be no results. However, it's the patient's own plasma. So there's no immunogenicity, no allergic reactions. And again, using device, if people are using needles, the only side effects that's reported, we've seen in the past with our practice also, is pain, swelling, bruising due to the needles and not due to the PRP per se. So PRP really doesn't have any side effects if you've chosen your candidate correctly. And the gap that I keep between both patients, between 2 sessions, like I said, is 3 to 4 weeks and not sooner. So 4 weeks minimum. We like to give 6 sessions. And then for another 6 months to a year, we don't give any session. Then we recall them after that because it's a biological process. It takes that much time for the results to start showing. All right. There's a question about post-care, if any. Whenever we do the PRP, we tell the patient to wash their hair maybe after 4 to 5 years, because there's some amount of deliverance still happening after the treatment. In terms of post-care, like I said, if you're using needles, then you need to have a separate kind of post-care where you need to tell them to wash it with an antiseptic shampoo or something. But with Mesoskin, all we are advising our patients is to wash it with a pH balanced shampoo. That's very important, to wash your hair with a pH balanced shampoo. We're of course also giving minoxidil. So that's another thing. But post-care, nothing specific for the hair at least. No specific post-care has to be taken here. Then can we wash hair after the treatment? Yeah, like I said, after 4 to 5 hours, they can wash the hair. If they come in the evening, we tell them to wash it the next day in the morning.
Okay, all right. So any more questions from our customers? If you have any doubts, please let us know now. Any questions about Mesoskin or device or the PRP treatment? Yes.
So
Okay.
I have a question. Do I
Yes.
have to type or I can ask? Hi, Dr. Pragati. So,
Hi, Dr. Nivedita. Hi, Dr.
hello.
Nivedita.
Hello. So, yeah, my question is the traditional PRP, which is with injections, right? The traditional PRP physiotherapy, vis-a-vis the results of electroporation. Are the results comparable, or there's definitely the result of the conventional PRP is superior?
No, of course, they have papers also published. And in our practice also, we've seen comparable results. Like I said, it's not better or worse, it's comparable. I think with PRP treatment, one of the things that leads to a better or worse result, or when the difference in results happen, is the preparation of the PRP. But in terms of the device, the way the electroporation, where the way their technology is working, it's comparable to the needles.
All right. So just one small follow-up question. So when we do electroporation mesotherapy on the skin, it is usually advisable to prime the skin before, like for example, with MDA or a mild skin peels, just so that the penetration is even better. That obviously can't be done on the scalp. Is that so?
So that's where the microneedle, microchip comes into play. I think Cornelius will probably share that information, where if you see the details of that blade, you're going to see tiny microneedles on it. And the purpose of the peeling or the MDA gets served with that microneedle, microchip stamp. That is what decreases the resistance of the epidermis, so that the electroporation can act better. It kind of depresses it, kind of creating like a small, not like an opening, but just stretching the epidermis enough so that the electroporation can pass through.
All right. But there is no such preparation that we can do on the scalp?
No, okay. It's not required.
All right. And just one question with the asepsis. Like there is a little bit of dripping when we do with electroporation device of the plasma. So how do you maintain the asepsis and sterility of the handpiece? Because we can't, autoclave it or something. It has to be superficial sterilization, right?
Yes. So the blade is something that we don't use for more than 2 therapies, because it does tend to also get blocked. We are using ETO for our blades right now, because we have tied up, because we're doing surgery. So we pack it up and we are doing ETO for the blades.
Okay.
Yes.
So my concern was just the handpiece end.
The handpiece, and we are clean. Yes, the dripping that has happened. Okay, the handpiece you're talking about. We clean it with your regular sterilizations. We clean it with that. Yes.
Fair enough.
Because that's not the actual part also which is touching the scalp.
Yeah, fair.
Yeah. All right, I think must combine with, yes, we do. I mean, PRP does not in any way negate the use of minoxidil or your oral supplements. We are using both of them together. You work with metal or PLA chips for the Mesoskin. I think they've come up with a new skin. I think Cornelius is a better person to answer this question.
Yes.
There's a question. There's a question about the material of your microchips for the Mesoskin.
Yes, right now we only cooperate with Toscani from Spain for the PLA microchips. For our doctor Pragati, she used the metal material for the treatment. Yeah. So after this meeting, we also will send Dr. Pragati some PLA microchips for testing. So any more questions from your side, from our customers? If there is no more questions, we will call it at the end of this meeting. And shall we end this meeting, Dr. Pragati?
Yes, I think.
Okay. So
before
we end this meeting, we'd like to issue Dr. Pragati trainer certification to thank her for this sharing. And we, as you can see from the screen right now, and we also prepared a gift for Dr. Pragati, which is 100 pieces of the microchips, including the new microchips, which made by PLA material just now I mentioned. And we will ship the certificate and the microchips together to Dr. Pragati after this meeting.
Thank you, Cornelius. That's very kind of you.
Yeah, you're welcome. So, dear customers, if you still have any other questions, please contact Dr. Pragati or contact your sales specialist or send email to info@wyndham.com. And Dr. Pragati and the Wyndham team will try our best to give you the right answers. And thanks for your understanding and support. And Wyndham wishes you a better business. See you.
All right. Bye, everyone.
Bye.